Hello, and welcome back to another episode of What Your Doctor Is Not Telling You. I'm Dr. Mollie James here. Thanks for being with us. The first one is school physicals. What are they? Why do we have to do them? And what is the point of doing that? How does it work? Most of us have a pretty good idea on that. Number 2 is vaccines. This is a hot topic. So we're going to talk about exemption rights in some of the main states and what you need to do for that. We're going to talk about the first 2 weeks of back to school. There's something that happens every single year, and you're going to know. And then finally, sports injuries. As kids go back to school, they're playing sports again. One of the common things we see is those sports injuries starting to hit again. And our James Clinic family knows that there's a way to treat and there's a better way to treat. And we're always going to go with the better way to treat because we know if a kiddo has an injury and we put them through our spins and what we do, they're going to get back to playing almost twice as fast. So they're not going to miss the entire season potentially depending on what the injury is. So we at least want to get that information out there because there's a lot of kids that aren't taking advantage of that. We find out afterwards, oh, we had a bad injury and forgot to call you. You adults do that too. Hey, I was in a car accident. You didn't call us. Same principles, different application. So, first of all, school physicals. Those are already in full swing. Some of you, 4 weeks cut off the fracture on an elite athlete. We know that for sure. That's a difference between finishing your season and making it in front of the scouts and not. So, huge impact there. So, step 1 is school physicals. Most of the kiddos have to have these. Some of them, it happens. The doctor, when I was training, we used to go into the schools and all the kiddos would line up and you would do your walkthrough. So there's a couple of things that we're really looking for when the kiddos come through for school physicals. First of all, you're going to track development. So when you see kiddo after kiddo in the same age range, especially the pediatric and family medicine, they're going to start to notice if a kiddo is off of track. If they're too big, too small, they're not keeping up, they are falling out of the norms. So at least you know that, and maybe there's nothing to do about it, but if there is something to do about it, that's our point to catch it. So tracking development number 1. So deviation from the pattern. Is there something we need to look into, or is this totally just a kiddo with an interesting deviation? Second is find what is silent. So one of the most important things we do is we listen to heart every year. We're looking for that hypertrophic cardiomyopathy. So when it used to be before 2020, when you saw kids collapse of a cardiac issue, it used to be tied to this, an unrecognized hypertrophic cardiomyopathy. Of course, the tide has changed on that. And now we have kiddos that are having to get MRIs, cardiac MRIs, echocardiograms, things like that, because we mistakenly went through and told all of them they needed COVID shots. Huge mistake. Most of us on this call know that. Lasting implications on that. So now we have to do a deeper dive and screen kiddos to find out if they've got a cardiac issue that's been harboring, developing, creating some problems. Lastly is clear them to compete safely. Those old injuries accumulate. Concussions are one of the big ones, right? We know now, we're looking at professional athletes that are in impact sports. So our boxers, our football players, we know that repeated injuries to the head without appropriate time to recover really is going to end up in difficult to manage depression, anxiety. These are the homicidal rage type things that we see as they get older. So we really want to emphasize concussion management and being proactive on that. It's not just go get a head CT and if it's negative, you're back in the game. There are certain things we need to watch for to make sure kids are ready to go back. So obviously most people focus on the form. There usually is a form for school. That's just us documenting for the school that we did our thing. So make sure you bring that form in with you as part of it because that's the time to fill it out. But really that's not the important part of the visit. The other things that our team does really on more of the well child side of it, parenting advice. So not as much the focus of the school physical. The well child visit, it gets heavily criticized right now as just being an opportunity to give vaccines. But really what it is, excuse me, it's an opportunity for parents to ask questions, deal with those behavioral issues. What do I do? They're 12, they're 13, they're not minding me. Getting parenting advice from the pediatrician sometimes can be helpful too. What should kids be doing? What should you challenge them in? What do you let them go and learn the hard lessons on? So that can be another upside. So again, things we're actually going to dig in and check into are, again, growth and development. So height and weight. We know the kiddos have the height curve. We're going to be looking at the BMI. Sadly enough, pediatric obesity is one of the biggest problems. We've seen that in the MAHA initiative and RFK Jr. That has so many downstream implications for chronic health management in this country. So knowing if your child is weight normal or starting to deviate off with a problem and getting their diet back in check, blood pressure issues, cardiac, we already talked about. A vision and hearing exam is usually part of this, not always in the medical office. Sometimes that's a secondary exam. Spine and posture. So we always did a scoliosis check to make sure as they are going through rapid growth spurts, we can start to find where the spine is actually in a curvature. And is there anything that needs to be done with that? We're very blessed to have Dr. Joe Figueroa in our office that can actually do some things that are non-invasive, but there are some of those that are so severe the kiddos are going to go on and have surgical interventions. So knowing that scoliosis is there is important. The musculoskeletal exam, how are their joints? How are they moving? Are they hypermobile? Just talking to them about possible injuries. Does anybody know what the most common sport for head injuries is? I'll watch the chat here. Most common sport for head injuries going into the school year. I have football and soccer. Those are not it. It is actually cheerleading. So if you think about those cheerleaders crawling up on the pyramids and falling down, cheerleading is number one for head injury. You can check that fact for me. Definitely football is up there. We think of the kids in the football helmets getting their bells rung. Soccer, I'm sure, is up there a little bit. Anything that has projectiles coming at the face is going to be a risk. So musculoskeletal exam and talking about those injuries and what to do about them. Call us and when to call us after that happens. Skin, thyroid, abdomen, just doing a good, again, physical exam. I'm going to interject here, probably not as much in our office and not as much kids coming in. This is the opportunity to look for those hidden bruises and signs that a child is being trafficked or being abused. So the kind of the ugly side of the world, but that's why kiddos have to come in and we have to disrobe to some extent to really look and see if there's a problem going on that nobody knows about. Sometimes it can be a very nice home and the parents don't even know it's happening. We've heard all kinds of stories around that. Mood, sleep, and the hard questions. As kids hit that awkward teenage age, they might be having some issues. We know COVID really changed the baseline for kids, and they're struggling much more than I remember kids struggling. I think some of that is technology, some of that is the disconnect with the online world. Definitely social media has created some mental issues for kids that we need to know about, we need to deal with proactively. We need to get those phones out of their hands till they're over 18, if possible. Diving into those kind of things. So the cardiac screen we talked about a little bit. We're looking for any major histories. Was there a relative that died suddenly? Looking for long QT syndrome. Marfans are going to be your really tall, really skinny people with long arms, like me. Just kidding. But you know the type, very tall, very thin. This is your basketball players. Their wingspan is bigger than their height sometimes. So those are important things. And people who, anybody in the family that's an outlier that had an intervention before age 50, we need to know about that. So if we screen positive for any of those children need to go to a pediatric cardiologist. We happen to have a great one on speed dial, but to get a full workup, the MCG actually plays a role here to work them up, maybe getting an echo, having a pediatric cardiology referral before we go out and play sports. I don't have to go into any further the number of died suddenly that we see on the field with kiddos who had these workups. So again, it's not a well child check. The well child things we're going to do is potentially labs, dig more into the day-to-day, the lifestyle things. We'll get to the vaccine discussion and just that's time to talk with a doctor and just what should I expect as my child is getting older versus just Are they safe to play sports and engage in school? So here's a couple of state requirements. I'm not going to get too far into this. I did have AI help me, so we're not going to agree with the top right box there. The Missouri State High School Athletic Association talks about which forms. Usually there's a big packet. We just fill out one page on that. It says who can do that. School entry, it's important to know how vaccines are sold to parents. Usually it's a here's what you must do to enter school kind of a situation. I know in Missouri specifically, they try to tell you have to go to the state department, or excuse me, the Department of Public Health to get a form. I would recommend not doing that. That puts your name on a list that's publicly searchable with a FOIA request, and then you're on the radar. So if you do not want to have vaccines for your kids, I would highly suggest doing a religious exemption first, and then we can talk medical exemption. I have people who've been asking me now for 4 or 5 years, can you do a medical exemption? I do not fill out the forms because that violates your rights. There's no reason a school should have your information, but I'll write a letter that says the kiddo was in our office, we talked risks and benefits, and here's what we decided. So I'll give you the letter, you staple it to the form, and you take it in. The better way to go is religious because nobody can poke a hole in that. And again, I disagree with the premise that they can accept or deny. You are not asking them to take your exemption. You're telling them you have one, and that's your right. You shouldn't even need an exemption because none of these things should be required. If any of you are in Illinois, here's a little bit on the Illinois requirements. So they're slightly different. And some of these informed choice organizations have lists per state of what you need to do and what you should do, as opposed to being what you're told to do to get that gets you on the radar and watching videos and things like that. You don't have to do those things. You have the right. So again, to be efficient and have get through it in one visit, bring that correct form the first time so we can get that filled out right on the spot. It doesn't take long. We'll scan it into your chart in case you lose it, and then we'll have it. If you do have vaccines, it's nice to have those on record. At our office, we don't emphasize that as much, but it is nice to know what the background is. Not that we're judging it and trying to fill it in, but if there's a pattern to a child's development or behavior, or even an adult, it might be nice to know and trace that back to things that they've been exposed to. The family history, shockingly, some people don't know that. Families don't talk, or they don't know their family if they're adopted or estranged. Old injuries, things that have evolved, something like headaches that have developed, maybe that's a sign they need a vision check or their glasses to be changed. So, and then if they get to that adolescent phase, parents are going to get booted out of the room just for a couple of minutes so there can be some one-on-one discussion. It's not anything unexpected. It's nothing personal. Sometimes kids tell more to the doctor than they do with the parent sitting in the room. So we need that opportunity to have a little one-on-one discussion in case they do have questions they don't want to ask or are embarrassed. Everyone's favorite topic. If I would have made this a Twitter live, we would have had thousands of people here tonight. And I think I got yelled at just this weekend for this. So if you're on Twitter, go put your 2 cents in. So I literally left this blank. I get all kinds of questions. What shots should we do? What shots do you recommend? The biggest one I actually get right now is the meningococcal vaccine question for kiddos that are 18, because I think by that time parents have pretty much figured out where they stand on everything else. I will say publicly in any arena, I am an absolute no on the COVID shot for any living human being who wants to stay that way, period. End of story. If you're low risk, you don't need one. If you're high risk, you can't tolerate one, period. No discussion on that. The fact that we just spent billions of dollars with Pfizer to get another mRNA COVID shot is sinful and shows that the FDA deserves to be disbanded. There's the one pediatric vaccine that it seems the evidence supports is a Hib. I'm going to mess it up now. It's the Hib, Haemophilus influenza B, because it has reduced the childhood illness and reduced the need for lumbar punctures. And if you have a baby, you probably don't want a lumbar puncture. That is from Liz Mumper's data. Everything else, I'm pretty much a no on. If you are a parent and you want those things, Dr. Farella has an impeccable record. She's always administered vaccines until COVID came along. So the way she gives them and the support she gives her kiddos, if you look at the autism rates in her patient population versus standard, she's like, I should have X number of autistic kiddos based on the data. And she has a fraction of that, like a tiny fraction. So the way she does it with non-preserved shots, spreading them out, giving probiotics and things like that, it seems to be very effective. Are there any specific questions on this topic before I move on? If you really want to deep dive in this, probably the biggest questions I get in the office, because I don't see a ton of kiddos, are from parents who are getting pressured from their family members saying, hey, daughter-in-law, daughter's having a baby, they won't let me come unless I get X shot. A really great book on this is Vaccines Amen by Aaron Siri. Can't emphasize that enough. He is an attorney that has cross-examined these doctors. So he has looked at every piece of data. He has broken it down. He lists the safety periods for all of the immunizations. You look at drugs, I think Eliquis was 7 years to production. If you look at other drugs, you're looking anywhere from 2 years to 20 years. When you line up the safety data for the immunizations, you're looking at days. Days, 5 days, 60 days. Any suggestions on wording to get the pediatrics, get them off your back? Yeah, leave them. Leave them. They shouldn't be on your back in the first place. And I'm a big believer in if they show you their colors and they tell you, believe them the first time. If they're on your back, that tells me they don't understand the data. And so they're not going to, if they can't make good decisions on one of the fundamentals of their practice, can they make good decisions on anything else? So I lost a lot of faith in my medical colleagues during COVID, I have to be honest, including my ICU colleagues. So yeah, I don't know how to get them off your back. Leave their practice. The only way we're going to move the needle on this is through the money. And if they start losing money, they'll have to re-examine. That's how every single healthcare organization changed their policies. When they had a doctor who made a lot of money for them, guess what? They were granted exemptions. Guess who wasn't granted exemptions? The janitor and the cook. So these healthcare entities that are doing this are criminal enterprises in the way that they granted exemptions, the way they forced things. You know, I sued 2 of them. Those are probably over. So important to know. Okay, if you have questions, we can come back to this. We really do respect your decision on this. It can be a confusing issue. I would say most of us have done the deeper dive just because we get questions on it constantly and want to know what we're talking about. I would say if you're in doubt, go without. So that's my general rule with minimal to no exceptions. Here's your exemption rights. These are the knee-jerk exemptions. So again, I would totally recommend that you go through. I don't think you need to show tier titers. You don't need to show immunity. The area we have had the least success are the healthcare education platforms. Believe it or not, they're still forcing these things on nursing students, medical students, physical therapy, anything along the healthcare professionals. Trade schools, we're having problems with them still. It's a sad day that this hasn't passed us by. Illinois is a little bit tougher. Again, do whatever you need to do. I know a lot of people who got the COVID shot so that they could go on vacation or travel or keep their job, and then they died. What are all those things worth if you don't have your health and you don't have your life? Every other state. So again, here's some resources where to start. I would look at informed choice organizations in your state. I know the one in Missouri has resources for all 50 states. So that's where I would start. And if you really feel strong about this, get involved with them. Here's the heart of what I wanted to talk about, because this impacts all of us. We all know that around Thanksgiving and Christmas and flu season, we all get sick. But the first 2 weeks of school, everybody gets sick. And we always forget because it's nice out and it's summer and everyone's out in the sunshine and the weather's warm. Those kids go to school and mix up their germs. They're bringing stuff home and everybody gets sick with sniffly noses for 2 weeks. So why do they do that? Again, they're exposed to new things. So they've maybe been in a relatively isolated environment for a while. They're exposed to new kids. We're back in close quarters, right? We're sitting at desks next to each other, drinking out of water fountains. You're in buses, you're sweating in the locker rooms and playing sports. Also, they're back on a schedule. So that bedtime, they fight it if I remember correctly, but they still have to get up early. So they start to get a little bit sleep deprived. They're in a new routine. They're a little bit stressed. So all of this interplays and they get sick, they bring it home, the teachers all get sick, your parents all get sick. They're calling into the office. So how do you head this off? Oh, and the diet changes, right? You're getting off of your nice summer fresh foods and back onto things. So, as a result of this, back to school asthma. So, we're going to flare that for kiddos. Parents go down next, right? Kids are sick for a day and then they move on, and parents are down for a week. So, what do you do to protect yourself? So, I'm going to emphasize a couple of those. You want to get your Cofix and your sick box on hand ahead of time. If I had a kid in my house, I would take some ivermectin preventatively. Make sure if you haven't checked the vitamin D level, you're doing that and get the vitamin D started as kids are going back to school. This is the time they're not out in the sun, they're back under those fluorescent lights all day. So let's get the vitamin D, let's get all their vitamins going, right? The multivitamin, maybe a little bit of C to boost them up for a couple of weeks. Make sure they're getting enough sleep. So this they might fight you on, but maybe start to shift bedtime back 15 minutes. Grade schoolers 9 to 12 hours of sleep, and then teens are 8 to 10 hours. So make sure we're working on that as much as possible. Start when they have to get up and work backwards. Lots of protein, so get some food in their breakfast. I remember when I was in school, we got the microwave pancakes and nasty stuff. So make sure they've got some protein, some eggs, scrambled eggs, hard boiled, some bacon, sausage, just something to get them going, maybe some yogurt. Make sure they're still outside. When they get home from school, let them go play outside, keep that vitamin D level going as long as possible till we hit daylight savings time. Make sure we're getting colorful food. So, eat the rainbow is really important. We know that nutrients come from what makes food colored. So, you want a variety of that every day. Fermented foods, if they like them. I think that's really fallen out of favor in our modern diet, but fermented foods are great to incorporate. And if you can teach kids to like them early, bonus points for you. This is a good time to revisit washing hands, hand washing, and nice sanitary. Don't share your water bottle with everybody. I don't know what the rules are now for hydrating in school, but make sure they have a water bottle and they've got access to a little bit. And make sure they don't go totally sedentary. Again, they might have been out playing all summer and busy running around, swimming all day. Now they're going to be sitting in classroom all day. So make sure they've got some activity to balance that out. They don't just sit. Um, Again, I like having that sick box in hand. And the first sign of symptoms, we're going for ivermectin, hydroxychloroquine. I really like the tonic MIC-P that targets Mycoplasma pneumoniae. That is an atypical, so that's what causes the walking pneumonia. Good thing to have on hand. Those herbal antimicrobials, love those. Cofix, silver, get your whole armamentarium ready to go. I really like the nebulizers too, because remember in the fall, we're going to collide between back to school and then allergies from harvest season are going to hit on top of each other. Their allergies are going to flare just when they're getting exposed to all this nasty stuff. So, when do you keep them home and when do you bring them in? So, you're going to keep them home if they've got a fever. Yeah, nebulizer with silver is fantastic. So, a fever of 104 or higher, usually we say 101 to call us and come to the office. 24 hours fever free without medicine, they can go back to school. If they've had vomiting or diarrhea in the last 24 hours, you really don't want to send them to school feeling nasty like that. A severe cough, a big rash that you don't know where that's coming from. I think chickenpox parties are few and far between, but if they've got anything that looks like that, those are super contagious. I probably would send them to school so everybody gets it and gets it over with and has natural immunity. Nasty thick eyes. So if they've got that thick matting on their eyes in the morning, hot rags and drain that. And then if they just can't focus or pay attention, you guys know the symptoms in your kids. When do you need to call us to get them in for an urgent visit? And we do see kiddos. So we have the concierge plan for kiddos. We also have individual visits. So they can do child, they can do sick child. We know that they use things, they're not on chronic meds as much unless they're on that you can go either way. I like concierge because you know where you're going to call and we'll get you in. But again, if you're plugged into the clinic, that helps you as well. If the fever has been going on over 5 days or keeps coming back after it breaks, or if the kiddo's pulling at their ear, that's a dead giveaway. Sore throat, if they've got the white nasty stuff, that's a sign of strep. We don't want to spread that around. So if they start to get better and then they backtrack, that's not a typical pattern. And then for our asthma kids, we want to see them pretty early on if it's not able to be controlled. Anytime the kiddo's got an ongoing condition, probably the biggest thing I think of for this is going to be our PANS Pandas kiddos. Anytime something hits, they're going to start having behavior issues. They're going to flare up a little bit and struggle a little bit more. So we want to see them on the early end of that so we can maybe do an infusion, put them in the hyperbaric. We have a lot of things that can break those fevers, hyperbaric, Trameal, things like that, that aren't drugs, that aren't going to reduce their glutathione levels. So if you need to bring them in now or bring them to the ER, so if they're really retracting their nose, if they're working hard to breathe, they need to be seen right away. Obviously, if they're blue, if they're super tired or super confused, like more than baseline. The meningitis, again, this is a little bit over dramatic, but if they have a stiff neck, so if it hurts when you push down the top of their head or it hurts when they move their neck, that's a sign of meningitis. We would want to see them right away. Dehydration is probably one of the easiest things that'll turn a kiddo around just like that. So I don't know the last time y'all have been sick, but you get a little dehydrated. Your labs can still be normal, but you feel really bad. A bag of fluid can be a miracle worker for you. So get them in. We're one of the few places you can go in any of our areas for kiddos to get fluids. And we do that under the supervision of our pediatric nurses and pediatricians. It's a great option. And then a fever of any in a newborn. So we need to take that seriously. Sports injuries. So again, kids are going to be playing more. They're back more in the competitive sports, football, cheerleading, volleyball. So more play, more injuries. So there's a couple different patterns to this. One is that acute injury. They land funny and tear their ankle or their knee. We want to get them in with ortho, but get them in with us as well because ortho will take care of the actual injury. We will take care of everything around it. So it is amazing what hyperbaric oxygen can do to reduce inflammation and lymphatics in a leg overnight. I've seen this myself on a couple of occasions. So get that done. Fractures, including growth plate fractures. So Katie was alluding to a baseball kiddo that broke their wrist. And we actually watched, she came from an ortho clinic. So she has the 411. Katie, I don't know if you can hop on and talk or if you're just observing tonight, but we can expedite. Here, I'll give you a mic in case you want to. We can help them get healed up and back to play so much faster. We can watch it on the x-rays. We've seen it on kiddos from the clinic, so we know it can go widespread. Concussions, again, we have an entire plethora of what we can do for a kiddo with a concussion, starting with brain gauge to evaluate and determine when they can go back, hyperbaric oxygen, IV vitamin infusions. No problem. Gotcha. So she's just going to answer questions via text if she can. But the concussion protocol, knowing what to do in that situation, we're not just going to do steroids and go to a dark room for sure. And then the stuff that really gets you down longer, muscle strains and contusions. I can tell you this firsthand when I had my car accident, those little things are what are going to slow you down. So getting in the hyperbaric chamber, using the things that we have are going to be important. Overuse injury, and both of these, Dr. Figueroa, if you're in the Des Moines area, he's going to be a great person to have on your team because not only, again, are you going to see the orthopedist and get in the hyperbaric chamber, let him deal with the compensatory injuries that you'll have by favoring whatever's injured. He'll get into the fascia around the injury to help it heal faster and get your lymphatics moving to reduce swelling. The overuse injuries, Osgood slaughter is a big one. That's your pain in the shin bone. We think of that as shin splints. There's a bunch of other ones too. Heel pain, elbow and shoulder, in front of the knee. Just anything that's growing and pulling with that overuse. So he can help. He actually does some ergonomic stuff too. So good person to have if either one of these is an issue. So in growing athletes, so our student athletes, we do have very elite student athletes that we take care of. The growth plates, we always have to look for, is the growth plate injured? Again, we're going to have our orthopedic colleagues involved in that. Growth spurt, this is when you're most susceptible, right? You're a little clunky, your center of gravity is changing, and you're doing all of these things. Flexibility and coordination are getting a little bit worse as things are shifting. Also, kids are so intense now. I remember when a long time ago when I was a kid, we'd play every sport and it'd be intense, but not. And now kiddos are doing camps and sports and hours of workout a day thinking they're on the pro track. So, really having the overuse and burnout early is something that we see. We know kids that are athletes are actually have immune suppression because they're so overtaxing their bodies with the physical, they don't keep up with the nutrients, and so they're at risk of having infections actually a lot more than healthy kids who aren't doing that. So we've got to watch them. We need to make sure that they're recovering, they're resting, they're recharging and refueling properly and getting all the nutrients in that they need. So concussion, most of us think about the football game where the kiddo goes down, they black out, and they head to the out in the ambulance, get a head CT. This can be anything from getting your bell rung and being dizzy, having headaches, a little bit of nausea, all the way up to head bleeds, and really the scrambled eggs, the diffuse axonal injury that I used to take care of in the ICU. Behavior issues can be part of this. So if somebody has had an impact and they're irritable, emotional, like they're off their baseline, we need to pay attention to those clues. And parents, you're the ones dialed into this. Also, because swelling doesn't happen at the time of impact, it increases over 3 to 5 days, is really the maximal swelling. Those symptoms can be a little bit delayed depending on the severity of the concussion. If they hit their head, they're out immediately. When in doubt, sit them out. They don't go back the same day under any circumstance. You can't trust a kiddo that wants to get in a game and says, I'm fine. No, you're going to go get an evaluation. So the second impact, you've got a vulnerable brain tissue, that second impact can really be damaging. Again, we know the criteria. If they black out, if they can't remember, so that they have an amnestic period, they need to go get a head CT to make sure they don't have an actual brain bleed or intraparenchymal bleed. Very rarely do they, but they can. An epidural bleed, those are the kiddos who are fine and then are found down hours later. Different injury patterns for those. The red flags and the things to know about, again, this is more high level, but I think you would figure this out, but good to know. The headache that keeps getting worse, vomiting out of nowhere, obviously a seizure, you're going to come in. If the pupils are different sizes, slurred speech, if they're weak on one side or look like they're having a stroke, it's important to know that. They don't recognize people they should, can't wake them up. So this is the annoying thing that we used to do after a head injury is wake them up every hour and make sure they can tell you who the president is. And then loss of consciousness, obviously, we're going to get at scans. So prevention for this, again, neuromuscular training programs. So there's actually strengthening programs you can do with a doctor like Dr. Figueroa that can actually reduce your risk of injury. He did this in the military, and I don't know if he's on tonight. Didn't think I saw him. But this is one of the things he did in the military. They created a training program and they had a much lower injury rate than the groups that didn't go through. So just being plugged into a functional or neuromuscular training program, because it'll evaluate your strength and weakness and get you optimized, fill in your blank spots before you get an injury. Load management, so making sure we balance that the stress time versus the recovery time. Sleep and fuel. So these athletes that are working so hard, 8 or more hours of sleep a night, their body has to clean up the damage. That's when they build muscle. That's when we clean out the brain. The lymphatics are working to detox the brain. Sleep is going to be critical during this time. Rehab properly. So when you have an injury, taking that seriously and making sure you're back to 100% before you exert again. Proper fitting equipment, obviously, and then heat. Going to 2 a day. Remember 2 days? 2 days in August. I don't know how anybody survives that, but excuse me. Really important for the kiddos to stay hydrated. So for every 2 bottles of water, the third needs to have electrolytes in it to restore and replace. So important to keep in mind. So when to bring an injury into us, obviously if you're going to the ER, if you're going for medical care, we're your second stop after that. If you don't go there first and you come in, we're probably going to get imaging to make sure that we don't have a fracture. So pain that goes on more than a few days, it should always be getting better. Inability to bear weight or a limp, persistent swelling. If there's point bone tenderness, we want to know about that. So there's other list of pain here. These are your overuse injuries. A change in mechanics is going to be a cue to either an acute injury or an overuse injury. All right, we're rounding the corner here. So hot takes from tonight. Get your school physicals scheduled now if they're not already. If they're not on the books, we have Dr. Baker in Ankeny. We have Ange Downs in Sheraton. We have an entire team in Chesterfield, Dr. Farella. We have Sarah Taylor. We have Kate Schroer and Justina Tim, all that can do the school physicals. So we've got you covered at every location. If you have your form, bring that in. Know about your exemptions. If you want to do one of those, get those going. Get your bedtime moved earlier and get your supplements and your sick box ready to go for the school year. You can even start preloading with vitamin D and multivitamins now if you haven't been doing that over the summer. So you're ready that first couple of weeks. Get your Cofix and your silver nasal spray ready to go. If your kiddo has asthma, get everything lined up. Make sure you've got refills and you're not running out of meds. And remember, injury, get the acute taken care of, but get to us step 2. All right. So we covered a lot of ground tonight. I saw some parents on here. I know there's some grandparents on here. Let's get to your questions now. Okay. I've got at least one question here. Oh, yeah. The title and author, Vaccines, Amen, by Aaron Seary, is such a good book. It's excellent. He actually goes through the entire vaccine injury. He goes through Stanley Plotkin and some of the big names in vaccines. He goes through their financial ties. He goes through the data of how they were proven. He goes through the Detroit study that got buried and why that happened. When you really know the facts, you start to question everything along those lines. So, perfect. All right. Any other questions regarding kids? We don't do a ton of pediatric topics. As Dr. Baker gets rolling with us, that's one of the things we've looked at is maybe adding a pediatric webinar once a month to cover specific pediatric topics. So if that's anything you would be interested in, let me know with a thumbs up. Our pediatric side of medicine is growing very rapidly. One of the things you guys just need to know as a James Clinic patient or insider is that we take care of some of the sickest kiddos. So the pandas, the autistic kiddos, we have solutions for them that the system hasn't even heard of and won't acknowledge. So it's not going to, I don't like the term fix. It's not going to fix things, but it might make things a lot better. What we want is if a kiddo doesn't engage with the world the same as everybody else, we want to lower that bar a bit, right? Anything we can make less challenging so that a kiddo can learn and be productive and be independent is what we want. So we've had kids that are nonverbal become verbal. So imagine being able to communicate in your world. These are the kinds of things we see. Kiddos that don't engage much, don't make a lot of eye contact, now having a fairly normal school year. Kids with lots of behavior disruption, kind of violent behaviors in nonviolent children that have melted away by the time we get proactive with them. If you know a parent who's struggling with that, just give them our name because they're looking for relief in any direction they can find it. And my team is really good at that. So I will leave it there. Thank you for being with us tonight. Oh, Katie has one little thing to add. My Pandas kiddo went from getting in trouble every day and leaving the room to spending 75 a day in class and reading at grade level and getting 100% days. I'll just throw that in there too. I think what we're going to find is the kiddos that fall into that into that arena are some of the most brilliant, and they just don't engage with the world in the same way. They don't pick up on the same social cues. So again, anything we can do to make life easier for them and their families, because that's a whole family journey, that's a good thing. This is literally severe enough that parents quit working to stay home with the kids. So it impacts the finances of the whole family. It impacts a lot of things. Not saying any of that is right or wrong, just saying it is a huge impact to not only the child, but everyone around that child. Love the pediatric topic. Great, Stephanie. Love to know that. We will work on getting more of those. Yeah, help us spread the word. All right, guys, thanks for being here. We always appreciate you spending the Monday nights with us. Next week, I got a little excited. If you caught it on social media for just a second, I caught it really quick. Next week, we are going to talk about hormone replacement in women. So we're going to talk about the peri, the meno, and everything in between. So that will be a very deep dive. It will be a heavy topic for the night, but about half the world is interested in it. Maybe more, because that also affects everybody. So good night. God bless. Thanks for being here. Have a good one.